Sorry. Okay, go ahead.
I'm in the mid-room and I'm going to collect my supplies. And I'll put this back in here. I should put this back in here. So I've gotten my supplies ready to go. And now I am going to check my orders against my MAR and then pull my medications and check those. All right, my patient today is Willie Make It. His date of birth is 4/15/43. He has no allergies. He's a full coat. All right. So Willie Make It. We have an order for a CBC, a CMP. So we'll draw some labs. And we've got a discontinue. And on page 2. Page 2, we have inserting IV. So we have all 3 orders for that. Now we have Willie Make It. Willie Make It 4/15/43, 4/15/43. He is going to get famotidine. We're going to find it on the MAR to make sure it matches. Famotidine. Dose and frequency, he gets 20 milligrams every 12 hours, 20 milligrams every 12 hours. He will get it at 8 o'clock. At 8 o'clock, and it is going to be an IV push. An IV push. All right, now I'm going to find the medicine and compare it to the orders and the MAR. Okay. We have Willie Make It 4/15/43. Famotidine 20 milligrams per 2 milliliters every 12 hours at 8 a.m. and it'll be an IV push. And the expiration is 3/20/30. On the MAR, we have famotidine 20 milligrams every 12 hours at 8 a.m. IV push, 20 milligrams per 2 milliliters. For Willie Make It, date of birth 4/15/43. All right, the next order is for Willie Make It 4/15/43. And he's going to get fluconazole, IV piggyback. He's getting 200 milligrams every 12 hours, IV piggyback. I said that probably already. 200 milligrams at 8 a.m. So we're going to come over to the MAR for Willie Make It, 4/15/43. Fluconazole. Dose is 200 milligrams every 12 hours at 8 a.m. IV piggyback, 200 milligrams per 100 milliliters, and it's going to go over 1 hour. So I'm going to run that for 25 drops per minute. And the bag doesn't seem to have any holes in it. There's no float, there's clear, nothing in it. Inspection. And I guess I'm just picking up an expiration. Expiration is January 1st, 2024. And And then he's dehydrated, so I'm sure he has an order for normal saline. Alright, we're on order for Willie Make It, 415.53. No allergies, and he is gonna get normal saline. We're gonna get normal saline, 50 milliliters per IV at 8 a.m. to infuse over 5 hours. So my drops on this one is real quick. Get this out of the way. We got 50 milliliters. I should have brought my nails because this computer is. Recommendation. 10 mils per hour. I'm gonna do that by the pump, so, all right, so 10 mils per hour. Normal saline, 50 milliliter bag, got that. IV, normal saline, 50 milliliter bag for Willie Make It, 415.43. It's gonna start at 7:30. IV, and the expiration date is September 2023. Okay. Now I'm gonna go over to my MAR and do one more check on the MAR for my last of my first checks. Sodium chloride, normal saline, 50 milliliters, 8 a.m. Oh, it's scheduled for 8 a.m. Gotcha. The start date is for today at 7:30. 50 milliliters IV, September 2023. I'm gonna go back up and just double check and make sure because I didn't say it out loud. Willie Make It, 415.1943. Right medicine, right patient, right dose, right route, and the expiration and the time. Okay, now I'm gonna leave here and I'm going to go out, maybe right outside the room or maybe in the nurse's station somewhere out of the med room, and I'm gonna do my second check and draw up my medications. Okay, I'm at outside the residence room, and I'm gonna close my orders, or just maximize my MAR. Let's just maximize my MAR. All right, I am on Willie Make It, 415.1943. No allergies. We're gonna start with the fluconazole. 200 milligrams. IV piggyback, 200 milligrams. You'll get it at 8 a.m. for 12 hours. Fluconazole, 200 milligrams per 100 milliliters. And we'll run it at 25 drops per minute. IV piggyback. So we have the right patient, the right route, the right dose, the right time, and we know the expiration is good. This one is not already flushed. Pre-started. Primed. Words are just gone out of my face hole. All right. Then I've got my normal saline for Willie Make It, 4/15/1943. We know the expiration is good. This whole bag of 50 milliliters is going to run in over 5 hours. At 8 a.m. it will start. Time, dose, route, person, expiration. We're going to clean my bag. Okay, my bag is primed. So we got the right patient, right route, right dose, right time, expiration, and right drug. All right, and then we have Willie Make It, date of birth 4/15/43. We got his famotidine, 20 milligrams, IV push at 8 a.m. He's to get it every 12 hours, so he'll start at 8, he'll get his dose at 8 a.m. And that'll be an IV push. We'll push that over about 2 minutes. Willie Make It, 4/15/43. We got the right patient. We've got the right medicine, famotidine injectable, 20 milligrams per 2 milliliters. He will get 2 milliliters, because that is what this medicine is. IV push at 8 a.m. So we've got patient, drug, route, dose, time, and expiration. All right, now I'm gonna wash my hands. And we're going to knock on the patient's door. Come in. Hi, I'm Amy. I'm your CVCC student nurse. I'm here today to, the doctors wrote you some orders for some IV medications and to start some fluids on you and start an IV. And then once the fluids run, we'll take the IV out. Is that okay with you? All right, I'm gonna pull this curtain so we can have a little privacy. Before we get started, can you tell me your name and your date of birth? Willie Make It, 4/15/1943. Thank you very much. Do you have any allergies? Okay, that's correct. We've got you noted with no known allergies also. All right. Is it okay if we go ahead and get started? All right. I'm going to get my stuff. I'm gonna adjust the bed, lift it up, which really I don't need to lift it up because I'm short. I'm gonna clean my hands. I'm gonna don gloves, and I did not stop. I'm gonna stop for a minute because during my second dose, second check, I was gonna draw this up and have it prepared to show to you. Really make it 1943. I got ahead of myself. All right, famotidine, 20 milligrams IV push, become 20 milligrams per 2 milliliters. I'm gonna don my gloves. I'm gonna clean off my top while it's drying. I'm gonna prepare my syringe, 2 mils. I'm gonna take and inject the amount into, flip it upside down, draw it up. Mils.
Okay. Okay.
Okay. Now, gloves off. I'll put those up, I promise. I'm just pretending that's trash can right now. Hands, and I'm going to, I'm sorry for the inconvenience, sir. I had to draw that medication up real quick. Now we can get started. I'm going to take a quick look at your veins. And I see one that we like. Bless you.
Excuse me.
Bless you, bless you. Okay, I'm going to clean this in just to be safe. Even though it was in the package, I'm just going to do it. I'm going to flush it and get that ready to go. I'm gonna trash out the way. Okay, so first things first, I'm gonna put on the tourniquet. These arms are so heavy. All right. I got a good vein. Is it okay if I lower this table?
Mm-hmm.
I didn't know if it was gonna hit your leg or not.
It may not lower.
Okay. I just didn't want to hit your foot or leg. All right. I probably shouldn't have put that on. I'm gonna pull the skin. There's gonna be a little stick. Well,
You can say you got blood return.
always get blood return. I bled out last week. All right, I'm gonna hold my finger above the line. Oh, and I'm going to flush. Then I'm gonna draw back and waste. Draw back and waste. And then I'm gonna get the blood for my labs.
That's good.
Okay. Where's my little? I'm making a mess here. I'm gonna attach my INT. Once I'm attached, I'm gonna pop the tourniquet. Clean out off my wet. Tegaderm. I'm going to take my gloves off. Clean my hands. Put my gloves back on because I did not lock it. Alright, I'm gonna flush. I'm gonna lock. I'm gonna take my pen. Date, time, and initials. Okay. Now, hands. I'm gonna take the blood, put it in my tube, date, time, put the patient's name on it, and send it to the lab. Okay. It's going to the lab. Okay. Wash my hands, and I'm gonna, all right, Mr. Make It, we have, doctor has ordered you some famotidine for that acid reflux, and I think he said something about you possibly having an ulcer, so he's gonna give you some famotidine for that acid reflux, and then you have a yeast infection in your mouth, so we're going to go on and hang some diflucan or fluconazole, and that'll run. With the fluconazole, you might notice a funny taste in your mouth. It does make stuff taste, funny. Some people, or most people, have complained about it. It can cause nausea and vomiting, seizures, drowsiness, and headache. If you have any of those, please let me know immediately. With the famotidine, with the having an ulcer or acid reflux, it's good for you to avoid drinking alcohol or any kind of smoking or fatty foods, greasy foods. If you notice after I'm giving it, if you notice that you're having any pain, trouble swallowing, bloody vomit, or your stool or black and tarry, if you'll just let me know with that too. We're also gonna run you some fluids to kind of keep you hydrated, okay? Now, if you're having any problems, if you feel any burning sensation or anything like that at the site, right now it looks good, there's no inflammation. When I was flushing it, did you have any, does it hurt or anything like that? Okay, all right, well, we're gonna get started with your medicine. Wash your hands, have on gloves. Actually, I don't have to put on gloves right now. Yes, I do. And we're gonna do our third med check at bedside before giving it. Okay, we've got our patient, the right patient is Willie Make It. Did I do it? Willie Make It, birth date 4/15/43. Willie Make It, 4/15/43. All right. First, we're gonna go to the fluconazole. And we're gonna put that. We're gonna get that to make sure, double check there's no holes and it's clear. Very good. 200 milligrams per 100 milliliters. 200 milligrams IV piggyback at 8 o'clock. 200 milligrams per 100 milliliter. Right patient, right dose, right medication, right route to 8 o'clock. And we know the expiration is good. We're gonna hang this up high. If it'll go on there. Okay. We got the famotidine injection for Willie Make It, 4/15/1943. Milligrams every 12 hours at 8 a.m. An IV push. The time is at 8 a.m. IV push 20 milligrams per 2 milliliters. 20 milligrams per 2 milliliters. You've checked that I have 2 milliliters and we have done expiration. And third check. Clear, no holes. Normal saline for Willie Make It, 4/15/1943. Willie Make It, 4/15/1943. All right, we're gonna get 50 milliliters at 8 a.m. IV to start at 8 o'clock. I just said 8 a.m. We're gonna set it for 25 drops. No, not this one. The fluconazole. This is just gonna run over 5 hours on the pump. Does your nose run when you get hot?
I'm actually cold.
Oh, you're cold. Mine runs when I get hot. Make that low. Okay, first thing I'm gonna do is I'm going to scan his badge. I'm gonna go ahead and give him the IV push. So I'm gonna scroll to where I can have it work.
Did it not pull up the
It didn't.
medicine? You may have to scan his armband again. It may have been too long. I don't know.
scan it in. There we
I
go.
think it just been some time.
Okay. I'm gonna leave that up because I haven't given it yet. Okay. I need a flush. Use this one as a flush. Alright, over 2 minutes. I'm going to Insight. Open it, pull back, get some blood, flush it a little. Lock it. Clean. Attach. Lock it. Push.
Yeah, don't really push it.
Okay. And I'm gonna do it over about 2 minutes.
Okay.
Now I'm gonna untake that off. I'm gonna clean and I'm gonna flush after that push and lock it back. Okay. All of this will go into the sharps container. And I'm going to chart that I gave 20 milligrams. Okay, chart. Alright, next, I'm going to go ahead and start the IV fluids. And plug that into the pump. Okay. IV fluids are open and going. 8 a.m. We'll do 10 milliliters per hour for 5 hours. Update chart. And then we're gonna start the IV piggyback. Fluconazole. I'm gonna clean the port. Stop it, and that's gonna go into the thing at 25 drops per minute. Update. Okay, while that's running, I'm gonna come and I'm gonna document. I'm gonna take my gloves off, wash my hands. And while his meds are going, I'm gonna come and document clean your hands, and I'm gonna document that I started the IV, that I used a 22 gauge, that the site was, there was no redness, no complaints of tenderness or pain when flushed. The gauge I used, 22 gauge, the date and time that I started it, and the medications, his medications were started. And I've already checked the order, so I know that when his meds are done, I need to discontinue his IV. Okay. So I've checked orders, washing my hands, knocking on the door. Hey, I'm Amy. I'm your CVCC nursing student. I'm back. It's time for me to discontinue your IV. Can you tell me your name and date of birth? All right, I'm gonna pull this curtain because I'm gonna take this IV out and get it all out of the way and get it off of you. Did you have any concerns, complaints, discomfort in your arm during the? All right, very good. All right, I need a piece of tape. Tape's ready. I'm gonna pull up what I used to clean his arm. Because I used it to dry up. All right, I'm gonna inspect the skin. Everything looks good. Is there any tenderness or pain to the site? All right. We are going to get it taken off for you. I'm going to try and pull toward the way the hair grows because it hurts. I have hairy arms. I'm going to apply pressure to the site. I'm going to pull it out and put it in the sharps container. I should have undone the IV first, but this is going to go into the sharps container. Tape it. And take the meds down. Those are really sharps. We want to keep this, don't we? That can go in there. I'm going to clean up my mess. Put it on the trash can. Hands. Lower the bed back down. Hand the patient the call light and ask him if he has any concerns, if he's comfortable, does he need anything, is he in any pain, how does his stomach feel, is it the medicine seem to be working? Yes, okay. I'm going to go back to my and chart that the IV was discontinued, catheter was intact, site there was no tenderness, redness, or complaints of pain or drainage. And I'm gonna go and wash my hands.